the changes that this government are making to our public, our healthcare system are of significant concerns to the people in my riding. You know, they call to share their hopes and their dreams, and I've been hearing so much from my constituents to ask the question, why is this government rushing to dismantle our public healthcare system, our publicly delivered world-class healthcare system that has been the envy of the world? And, you know, as has been said here, healthcare is in crisis. We acknowledge that. We recognize that it's in a crisis, but it's this government's job to fix that crisis with the solutions that they already have before them, not, in fact, to make it worse. And so, for example, in Hamilton, we have world-class healthcare facilities. We have, you know, Hamilton Health Sciences. We have McMaster's Children's Hospital. We have St. Joseph's. These are world-class hospitals that are struggling under the underfunding, the lack of funding, the lack of support that they need to be able to continue to deliver the health care that people of Hamilton need. And it's been said many, many times here that the solutions, in fact, it's been said that you've manufactured this crisis, taken hallway health care that was a legacy of the Liberals and doubled down by making it worse by underfunding health care and by introducing Bill 124 that is created and exacerbated a healthcare, a human resource crisis. So it's a mystery to me why this government would, rather than make the easy solutions, which are to fund the healthcare hospitals that we have, these world-class hospitals, rather than cutting them off and letting them have to put people on wait lists for surgery, why you wouldn't make sure that they have the adequate funding, why you wouldn't make sure that the money that you have in contingency funds and $12 billion of unspent money that could be going right now to address wait lists. Why are you not doing that? Why is that not your first choice? Why are there 12,000 children on a surgery wait list in the province of Ontario when you could start to address that by making sure these closed operating suites, these unused facilities, are opened again so people can start getting the procedures and the surgeries that need to save lives and to relieve pain and suffering and the fears of parents that are hoping that their children would get the care that they deserve under this government. I also wonder why you continue to disrespect healthcare workers, nurses and PSWs, and refuse to repeal Bill 124. You continue to underpay them in a time when they are burnt out and they're stressed and they're doing the best they can in a system that you have destabilized further. Why are you taking nurses and PSWs back to court on Bill 124 when it's been shown that this is an unconstitutional bill? Why is that not your first act? So the question really stands, why are you rushing rather than looking at the solutions that are before you? Why is your first act, the thing that you're putting all your effort into, is to introduce profits into the healthcare system? It's been called the privatization of our healthcare system, and it's hard to describe it as anything other than that. You know, we have talked in this House about the proud history of the NDP and Tommy Douglas and our Medicare system. And all of you know, and all of you have been hearing from constituents, that that is the pride of Ontario. That's one of the things we're so proud of, that people can get access to the health care and the emergency care that they need despite their ability to pay anywhere in this province. And to now go down the road of a two-tier healthcare system is exactly the wrong direction, and nobody, if they understood what you were doing, would support this. And I can only imagine that you are also hearing from your constituents that this is not what they expected, and this is not where they want to see you going with their precious healthcare system. But you know, well, rather than taking the steps that you know will help to relieve the burden and will help to improve our publicly delivered healthcare system, you still are rushing to introduce privatization without learning the lessons of the past. I mean, there are in this bill, there are absolutely no protections for patients seeking care in private, for-profit run, corporatized facilities. It's not in the bill. And I mean, all you have to do is learn to look at the evidence that comes from what already exists in private independent health facilities. And, you know, the report from the Auditor General is invaluable, and I wonder whether the members of the the opposite members, the MPPs, whether the ministers have taken into account the findings of this value for money audit that the Auditor General has put out, because the warnings are there, and the recommendations to protect patients, both protect them financially and protect their health outcomes, are in this report. But nothing has been put into this bill to address that. So let me just point out some of the highlights, or not really highlights, some of the actual dire warnings and recommendations that come from this report that should have been included in this bill are not there. I'm just going to start by, it's interesting reading if you take the time to look at it, but really the Auditor General said that there is no inadequate and inconsistent monitoring of the quality of outpatient surgeries. So no one's monitoring the results, the outcome, how people fare after they have surgeries or procedures in these independent healthcare facilities. There's no inadequate monitoring. There's also no regular review and monitoring of funding and billing for outpatient surgeries. So it's all fine and dandy for you to say that people won't have to pay extra. It's absolutely not the truth, because in Ontario, people already pay extra for these procedures. They pay dearly for these procedures. And in fact, the Auditor General goes on to say that there's absolutely no provincial oversight to protect patients against inappropriate charges. The ministry does not have has not sufficiently reviewed unusual billing patterns or trends to identify possible issues such as inappropriate billings or inappropriate renderings of service. This is the findings that the Auditor General did in 2021, and these problems still exist and are only going to be exacerbated by this bill. I think it's really the overall conclusion of the Auditor General that speaks to the two protections that people should expect from a government: to protect them financially and to protect their health outcomes when they are being driven by this government to private for-profit clinics. The Auditor General says clearly the ministry does not have a centralized way to measure and report on surgical quality and outcomes for all surgeries being performed in Ontario. That's shocking. There's no oversight in place, and this bill does not put any in place. The minister also, the Auditor General also goes on to say that we found that some patients could be given misleading information as part of a sales practice to make a profit. So the warning is here. This is already happening. People's outcomes, the quality of their outcomes, are not being monitored, and the fact that they are being charged inappropriate and overcharged for fees is not at all being addressed by this government, and I'm curious to know what the government is doing to address these recommendations and these findings from the Auditor General. I mean, the Auditor General's work is invaluable to all of us in this House to do our work. Her work is stellar, and her work is invaluable. She's an independent officer of this legislature, and we should be listening to this and using this to make our bills better, to improve our bills. She said, with mincing no words, the ministry is putting patients at greater financial risk by allowing additional private organizations to provide publicly funded surgeries while also being allowed to charge patients directly for additional uninsured services to make a profit without appropriate oversight mechanisms in place. There it is. It's happening already in this province. You're putting a bill forward that's going to double down on this, that has not in any way addressed those concerns. So, my question to the government would be, what happens if something goes wrong in one of these private clinics? What is the procedure when there are complications or urgent issues that arise? How will this impact our emergency rooms that are already closing? Have you considered any of this? Because it's not in the bill, and in the debate that I've heard, you don't address any of the concerns that people have. And so I would just say, despite the despair that we feel that this government is not protecting people when they need health care in this province, that in fact you're protecting profits over patients. I just have to end with a quote from Tommy Douglas, because it is the anniversary of his passing. So despite the despair that we feel, I think Tommy's words would be, "Courage, my friends, it's not too late to build a better world."